are we going to do for those of us who are disabled, like I am, that yes, Medicare picks up Blue Cross Blue Shield raises the amounts. However, Blue Cross Blue Shield continues to raise the premiums, even though they know they're disabled and you can't pay those premiums. And so something needs to be done to help those of us, which will come, or Osama Obama did never not speak one word ever in any of his speeches about what he was going to do for those of us who are disabled. It has been open to the whole public, and never not one word was ever spoken about those of us who are disabled. And I want to see the bill where you're disabled and you have a secondary insurance, whatever time you got approved by Social Security, Blue Cross Blue Shield, Cigna, United Healthcare, all those others that become what you used to use as your primary care until you get to be a Medicare patient or Medicare age. How are we going to stop those of us who are disabled who cannot afford, because we're living off a disability, to stop making our premiums go up on secondary, even though you have AARP, which tries, but you must switch to AARP.
Let me just say, I think I speak on behalf of everyone here. You are in our thoughts and prayers in your struggle with cancer. Second, that's part of why I began tonight saying I believe in healthcare reform. I talked about essentially high-risk coverage or coverage for people that are in your situation. The current system encourages the health insurance companies to push you off into Medicare and to leave you with only Medicare to pay your bills. I personally believe that someone like you who's fighting cancer ought to have to also face a struggle for how you're going to pay your bills. I began earlier tonight saying we had made a decision as a society that nobody should be forced to go bankrupt or unable to pay their mortgage or their food bill because of a medical condition. And I think we can do that. I think it's something on which we agree, and I think it's something that, and I have to move on. That.
One question that people could stand up behind you. The other problem is, those of us who are on disability are in fear of losing our homes.
I understand that. And that's why I said we shouldn't have that system.
What are they going to do for those of us who Obama said, nobody will lose your home? But I have got 4 different agencies who will tell me, I have to get a job, get rooming, learn how to my budget, sell my home. That's not what I'm trying to do.
My bill would say you don't have to do that. It's my goal to make sure you don't. And my goal to pass a bill that will not put you in that position. Yes, sir. Okay, go ahead. Yes, sir.
Being honestly in person, finding the website in the past 2 weeks, it's a lot more frustrating than this. I took your advice. My wife and I are both politically interested. I've been on that charter for 15 years, so I have personally as well as professional political. My wife and I interacted, and I've probably 100 colleagues.
Hold it up here. They want to, those that have stuck in here this long and have listened this long, they want to hear. So
we've spent the past 2 or 3 weeks constructing what we think is a good bipartisan plan as a follow-on activity to kind of the bilateral thing that's going on right now. It's been discussed with physicians, lawyers, accountants, insurance people. We wrote it up. They did it both conservative and liberal elements.
Right.
So my first question is, would you please read it? It's only 8 pages.
Yep. Yes, ma'am. You're next.
We have a group of physicians and other professionals here in Arizona that would like to address one component of the solution, which is the potential for free clinics to take care of this lady issue and some others. We need to get some help
Okay, this is the last question I'm going to answer because we've got to move on. What he's talking about is a lot of doctors that we have to give away free healthcare. Indeed, in America and an era gone by, doctors did give away, I think, a lot of free healthcare. But in today's litigious world, many doctors are afraid, indeed doctors would be idiots to give away free healthcare, because when they do, first they give away free healthcare to and go hire a tort lawyer and sue them. I introduced a bill, an amendment, it was an amendment in the Congress committee several years back, which would have said that if a doctor gives away free healthcare in a hospital, in an emergency room, under a call, or a hospital provides free care in its emergency room, under a call, then that doctor in that hospital would be defended in any malpractice action by the federal government, because it's the federal government that forced them to give away that free healthcare. Unfortunately, my amendment got crushed because the politicians didn't want to pay for it. The politicians are happy to make doctors and hospitals give away free healthcare under EMTALA, but they don't want to pick up the tab for the malpractice. Again, we've got to change the Congress because that's just unconscionable. Yes, ma'am. Thank you for coming.
Young man, by the way.
I'm sorry?
Young man, by the way.
Okay, again, thank you.
First of all, on the international charts of healthcare, America ranked as number 37. I think that's very sad. Knowing that we're the best country on the planet, we should have the best healthcare policy and the best healthcare to everybody in our country.
I agree.
Me being America's future, and what everybody's insisting is what I'm going to have to do to make socialized medicine a possibility, is that I have to pay for other people's medicine. I will be happy to do that. Because I know that there's other Americans out there that don't have it as good as me. And I'm willing to pay for that because I know they're fellow Americans.
Good for you.
And
absolutely. And thank you for coming here and expressing that.
Thank you.
Absolutely. Good job.
Last week at a town hall meeting in Oklahoma, there was that woman who had a husband who had a traumatic brain injury, and the insurance company picked her out of the hospital. She was crying, didn't have any way to go on her feet, or couldn't make sure she had a drink or anything like that. The senator's response was that he felt it wasn't the government's responsibility, but that it was the community's responsibility. Do you feel it's the government's responsibility to assist in that, or not?
I did not see the town hall or follow the story. However, let me try to answer your question and you tell me if I've answered it. I personally have tried to make it pretty clear here that I think insurance companies, health insurance companies, are getting away with economically cutting a fat hog at the expense of the American people. And I believe, and I fought for this when I fought on the HMO patients' rights legislation, that there are health insurance companies in America that are cheating people and kicking them off plans when they shouldn't be kicked off. I told you I met with an insurance broker today. There were really 5 of them come in. One of the gentlemen told me that his son had died of the consequences of diabetes. But before he died, Blue Cross Blue Shield of Arizona had kicked him off of his plan and forced him to go on